Hello, my name is Courtney Littleton, and I work for Mississippi Department of Mental Health. I am the project coordinator of the Mental Health Awareness Training Grant. Today we're going to talk about focusing on your mental health during COVID-19. The Mississippi Department of Mental Health provides hope by supporting a continuum of care for people with mental illness, intellectual or developmental disabilities, alcohol, and drug addiction. Services are provided through our state-operated programs and community service programs, regional community mental health centers, and other nonprofit, profit service agencies and organizations. Are you feeling sad, anxious, fearful, lonely, or angry? During the COVID-19 pandemic, we've had to adjust to living with social distancing, quarantine, and uncertainty. Our stress levels and worry may have doubled due to the loss of jobs, educational opportunities, and the worry about our health, along with added responsibilities such as educating our students. It's common to feel this way with the stress and uncertainties of COVID-19. When these feelings impact our ability to function each day, it is possible that you could be developing a mental health problem. What is mental health? Our mental health is vital to our overall wellness. Think about it. When we aren't feeling well physically, we probably aren't feeling our best mentally. When we're sad or anxious, we may not feel our best physically. Mental health and physical health go hand in hand, and we should remember to treat them with equal care. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. Basically, how we handle stress, relate to others, and make choices. Eating healthy foods, exercising, getting enough sleep, and practicing self-care can help protect your health and wellness, both physically and mentally. Don't be afraid to seek help if you are experiencing a mental health problem. If you have a stomach ache or a broken bone, what do? You seek help from a professional, right? The same should be true for your mental health. We will talk more throughout the training about ways to care for your mental health and when you want to consider seeking help. Although the terms are often used interchangeably, poor mental health and mental illness are not the same things. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of physical, mental, and social well-being. Mental illnesses are conditions that affect a person's thinking, feeling, mood, or behavior. Common mental illnesses include depression, anxiety, bipolar disorder, or schizophrenia. Mental illnesses are not likely to get better on their own, but they are treatable. 1 in 5 people experience a mental illness. Half begin by the age of 14, 3/4 by the age of 24. Such conditions may be occasional or long-lasting, and it affects someone's ability to relate to others and function each day. Each person's story is different, and recovery from mental illnesses is possible. People who have been diagnosed with a mental illness go on to lead many meaningful lives through their work, education, social roles, and in their families, especially when they seek help, when they get treatment. Mental health problems aren't the result of one event. A person's genetics, life experiences, lifestyle can influence whether they develop a mental health condition. Biochemical processes and brain structure may play a role in whether a person will develop a mental health problem, as do stressful or traumatic life events. 1 in 25, an estimated 10 million American adults live with a serious mental illness like schizophrenia or bipolar disorder. Mental illnesses can happen to anyone. No one is exempt, regardless of your age, race, income, or your education. There are many risk factors that increase the probability that a person may develop a mental health disorder. Many mental health disorders share risk factors. Some of these risk factors are genetics, a history of mental illness in a blood relative, such as a parent or sibling, stressful events, abuse or trauma, stressful life situations, such as a financial problem, a loved one's death, or a divorce, a childhood history of abuse or neglect, learned behavior, chemical imbalance, illness that is life-threatening, chronic, or associated with pain, an ongoing medical condition, brain injury, brain damage as a result of a serious injury, such as a violent blow to the head, substance misuse, use of alcohol or recreational drugs, seasonal changes, previous episodes of mental illness or presence of another mental illness, ongoing stress and anxiety, medical conditions as stated earlier, and hormonal changes, and then also side effects of medication can all be risk factors for the development of a mental illness. The trauma is the most powerful risk factor on this list. What is trauma? What is a traumatic event? A traumatic event is an incident experienced by a person that is perceived to be dangerous and threatens serious injury or death. A traumatic event may be on a large-scale disaster or may only happen to a single individual. Trauma is not always just a single incident. Rather, it may be reoccurring abuse or bullying. One person may perceive an event as deeply traumatic, but another may not. Certain types of trauma affect some people more than others. A history of trauma may make some people more vulnerable to later traumatic events, whereas others become more resilient. Common examples of traumatic events include accidents, assaults, including physical or sexual assault, mugging, robbery, or family violence, and witnessing something terrible happen. Mass traumatic events include terrorist acts, mass shootings, warfare, military activity, and severe weather events, such as hurricanes, tornadoes, fires, and floods. Coping with the death of an important person in one's life, painful medical procedures, and pandemics such as COVID-19 are all examples of traumatic or of a possible traumatic event. The COVID-19 pandemic can intensify existing mental health conditions and cause new stress-related symptoms. People who may have acquired COVID-19 may go on to be hospitalized, which may cause trauma for them and for anyone close to them. Others may experience trauma from the environment that the COVID-19 pandemic has created, such as being unable to see loved ones, having feelings of isolation, experiencing disruption to daily lives and routines. Others may also experience grief due to the death of a loved one. COVID-19 pandemic has created stressful working environments for many people. Having regular contact with people who experience severe symptoms of COVID-19 or may die from it may become traumatic over time. Everyone reacts differently to stressful situations, to trauma, such as an infectious disease outbreak. You may feel, and after this pandemic, you may feel anxiety, worry, and fear related to your own health status, the health status of others who may have been exposed to the disease, the resentment that your friends and family may feel if they need to go into quarantine as a result of contact with you, the experience of monitoring yourself or being monitored by others for signs and symptoms of the disease, time taken off from work and potential loss of income and job security, the challenges of securing things you need, such as groceries and personal care items, and concern about being able to effectively care for children or others in your care. You may also feel uncertainty or frustration about how long you would need to remain in this situation, and uncertainty about the future. Loneliness associated with feeling cut off from the world and from your loved ones. Anger if you think you were exposed to disease because of others' negligence. And boredom and frustration because you may not be able to work or engage in regular day-to-day activities. These emotions you feel may cause you to have uncertainty or ambivalence about the situation. And ambivalence is just the act of having mixed feelings, having a bunch of different feelings about a situation or a person. A desire to use alcohol or drugs to cope. Symptoms of depression such as feelings of hopelessness, changes in appetite or sleeping too little or too much. Symptoms of post-traumatic stress disorder such as intrusive distressing memories, flashbacks, nightmares, changes in thoughts and moods, and being easily startled. As adults, we have to take care of ourselves and to be able to take care of others. And so during this time, it is so important to know and understand that you are not alone. You are not alone. Even if you are alone in your home, there are ways to connect to others for support via the internet or by phone. It is also normal to be experiencing these feelings. Any feelings that you're experiencing during this time is normal. And finally, it is okay to need and ask for help. It is okay. As adults, we need help too. It is okay to need and ask for help. We want you to be able to support yourself. And these are just ways to support yourself. We encourage you to monitor your exposure to media coverage, educate yourself on the risk, stay up to date on what is happening, look for credible sources for information, understand the risk, and consider the real risk of harm to yourself and others around you. But limit your exposure to the media coverage of COVID-19. Find a reliable source to listen to and to be able to listen to in order to get your information to stay up to date. I want you to take care of your physical health by eating well and getting exercise. Hope. Keep a sense of hope and positivity with your thoughts and interactions. Connect. Even when practicing social distancing, you can connect with others. Make time to have phone calls or video chats with your friends and loved ones. Reaching out to people who you trust is one of the best ways to reduce anxiety, depression, and loneliness and boredom during this time of social distancing. And advocate. Be your own advocate. Speak up and speak out about your needs. It is particularly important if you are in quarantine. Ask for help. Find services. Ask a family member or a friend for help if you need it. Get support. Reach out to your healthcare providers. On the next two slides, we're going to talk about ways to cope, ways to remain calm and to relieve stress. So ways to cope and ways to self-care. Coping skills are the daily go-to tools that help to relieve stress and improve mood. Self-care is the regularly scheduled maintenance that helps to prevent and restore oneself from stress. So we want you to figure out what works for you to cope, to help you to get through stressful times, day to day. Sometimes it's minute to minute. So what are some things that can help you to cope? So we encourage you to relax. Relax your body, often by doing things that work for you. Take deep breaths, stretch, meditate, or pray, or engage in activities that you enjoy, like taking a walk, writing, drawing, painting, listening to music, talking to others, things that you enjoy. Pace yourself between stressful activities and do something fun after a hard task. Talk. Talk about your experiences and feelings to loved ones and friends if you find that helpful, and if you trust, find someone that you can trust. And then continue to maintain that sense of hope and positivity. What is self-care? So self-care refuels us, and it does not take from us. As stated before, self-care is to help maintain yourself, a balance in your life, and so self-care should refuel us and should help us to relieve that stress. There are 3 golden rules about self-care. And rule number 1, stick to the basics. Find something that works for you. Find something that works for you that's simple. Over time, you will find your own rhythm and routine. You will be able to implement more and identify more particular forms of self-care that works for you. But find something simple that works for you and something that you enjoy. Self-care needs to be something you actively plan rather than just something that happens. It is an active choice, and you must treat it as such. Add certain activities to your calendar, your routine, and announce your plans to others in order to increase your commitment, and actively look for opportunities to practice self-care. Be aware, be mindful of how your self-care activity made you feel and what the outcome was. And if the outcome was not positive and you did not feel refueled and re-energized, then it may not be the activity for you. Self-care means different things to different people. A few examples of self-care is promoting a nutritious, healthy diet, getting enough sleep. Adults usually need 7 to 8 hours of sleep each night. So just getting enough sleep, exercising, doing something that's good. And exercise can be good for our emotional health as well as our physical health. Follow up with medical care. It's not unusual for us to go to the doctor and forget to follow up or forget to make that phone call. And so just be sure that we follow up with our medical care. Make sure that we're doing our visits. Use relaxation exercises. Anything that helps you to remain calm and helps you to calm down. Practice meditation. A few of those things we talked about in the prior slide. Walking, running, writing, listening to music. Spending enough time with your loved ones is another good self-care. Spend time with your loved ones doing something fun, something relaxing. Ask yourself, make a plan. What can I do for self-care? Who can I talk to for support? What can my family do for self-care? In times of COVID-19, we're with our families more, we're in the house more. And so what can we do as a family, as a collective family together to relieve stress and to self-care? Because we all need it. We all need to be able to refuel and feel better. Mississippi recently launched Mental Health Mississippi, a website created to help you easily access mental health services for children and adults in Mississippi. And so this is just a list of resources along with the website that you can utilize in times when you feel like you need services, when you feel overwhelmed, frustrated, and you may need someone to talk to other than family members. These are some resources that you can utilize. You can search mentalhealthmississippi.com for services and resources in your local area. You can visit the site to also find COVID-19 resources and other resources such as our mobile crisis response teams, crisis lifelines, and DMH helpline, all of which are available 24 hours a day, 7 days a week to help. Isolation from family and friends, job loss, and death are challenges we're all facing during these days of COVID-19. You are not alone. COVID-19 is affecting families across the world. We encourage you to stay connected with your loved ones while practicing physical distancing. It's important that you support one another during this difficult time, especially if your loved one may be facing, or you may be facing, a mental health concern. If you or someone you know feels overwhelmed with emotions like sadness, depression, or anxiety, or like you want to harm yourself or others, please contact 911 or utilize the services and the resources listed on this slide. The crisis lifelines. Remember, you're not alone. If you would like to learn more information about mental health and mental health in children or your children, contact me about Youth Mental Health First Aid. Mental health first aid is the initial help offered to a person developing a mental health or substance use problem or experiencing a mental health crisis. The first aid is given until appropriate treatment and support are received or until the crisis resolves. The training is offered at no cost to you through a mental health awareness training grant from the Substance Abuse and Mental Health Service Administration. This training has been approved to offer continued education units for educators and school resource officers. For more information, please contact me, Courtney Littleton, at courtney.littleton@dmh.ms.gov. I would like to thank you for taking the time to view this training today. We hope that it was helpful and it gave you some knowledge and some resources to utilize if you need help. Remember that you are not alone. If the Mississippi Department of Mental Health can help support you, please don't hesitate to contact us. Both the DMH helpline and disaster distress helplines are available 24 hours a day, 7 days a week. Don't forget to practice self-care and stay healthy.